Thank you, Honourable Speaker. And following on the questions from the member of the official opposition, mental health is a significant issue, a significant root cause for many of the challenges that we see with the deaths from this illicit toxic drug supply. And what doesn't exist for a lot of people is access to mental health services when they need it, where they need it, in a way that there aren't barriers of affordability, accessibility. And the Premier earlier in his comments said today is a day for ideas from all parties in the House. And we have put an idea forward about how to ensure that there is accessible mental health care for everybody in British Columbia. And that is to bring psychologists under the medical services plan so that they are part of the primary care network, so that nobody in BC has to wonder how they're going to get access to mental health care in this province. My question through you is to the Premier, is that an idea that will be considered? Is it going to be in the budget? Will we see mental health care be a part of our medical service plan system?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Our government agrees with the opposition that access to mental health care and addiction support should not depend on the size of your budget. I'm very encouraged that in cooperation with the health authorities, we've been able to announce just in the last month 100 new publicly funded adult addiction treatment beds. That's just one example of the plan that we are building out. The opposition, the third party's suggestion from BC Psychologists Association is a generous one. The Premier has asked me to, in my mandate letter, to investigate removing barriers to access to mental health counselling. Psychologists are an important part of BC's mental health care system. They are not the only practitioner, but we are very grateful for their work. In most, particularly right now, they are employed at a great many of our new urgent primary care centres, which are delivering 7-day-a-week access to people in mental health and addictions treatment and crisis. We need to bring all the great diversity of approaches. For example, the $15 million that we've just put into 49 community counselling organizations. All of these efforts work. We need all hands on deck to face this crisis.
Thank you. Leader of Third Party on supplemental.
Thank you, Honourable Speaker, and I appreciate the Minister's response and recognition of this proposal and importantly the recognition of how important mental health care is to everybody's health. I think that the challenge that a lot of people in British Columbia have right now is that if they are experiencing mental health challenges, that one of the biggest barriers they have is, can I afford to pick up the phone and make an appointment with a counsellor in this moment that I need it? And when that isn't available to people, what we find is that people are in crisis when they finally seek care for their mental health struggles. They end up in hospitals, they end up in psychiatric units, and they end up costing the system quite a bit more than had they had the proactive ability to be able to get the counselling when they need it and where they need it. And so my question again to the Minister of Mental Health and Addictions, recognizing that even in her title, mental health and addictions are recognized as being connected, what further steps can we see to ensure that every British Columbian can have immediate, no barrier access to mental health care when they need it?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. Meeting, I think, 2 weeks ago with the parents in Mum Stop the Harm. Some of the parents urged us very much to think of addiction as a mental illness. They don't make any separation between the two. So I appreciate the member opposite drawing again that link so strongly. That we, especially during the time of COVID, have been able to move in the greatest transformation, I think, in BC's history because of this crisis of COVID, to move mental health counselling to an online and on-phone platform is a great testament to the community organizations and the BC Psychologists Association that helped us in that with some of that early counselling access. So anybody that is watching that is in crisis or needs help or is feeling anxious, as the member says, we do want to deal with problems while they are still small ones. please reach out for help. I've confirmed and reconfirmed that there is help available. You can go to gov.bc.ca/COVID-19 mental health supports. There's a great variety of services available at low cost and no cost, and we are continuing to invest to build out the supports that people need. There's more for us to do.